welcome again for the 27th, I think, interview of that scientific meeting. You are at hashtag CR Arthritis with the Canadian Broadcast Network, Arthritis Network. And I'm Isabelle Troïtzky. I'm with Arthritis Consumer Experts and the Global RA Network. So we are in Quebec City. We're at the annual scientific meeting for the Canadian Rheumatology Association and the Arthritis Health Profession Association. So for this interview, I'm super happy to welcome Melissa Holdren, who's a resident in rheumatology at the Schulich School of Medicine at the University of Western in Ontario. Welcome.
Thank you.
Thank you for spending the last 10-15 minutes with us. So very happy because I don't think we had a resident in rheumatology before at this on this conversation. Melissa, I'd like to ask you first of all what your involvement in rheumatology. You're a resident, but I think you're also part of CATCH. So I'd like to learn a bit more about what CATCH is, or so that our viewers can see that, and your interest, what research projects you may be involved in, and also what is a residency in rheumatology? What is training? What resident or future residents can expect? So there's a lot of questions. So we'll start by what you're doing currently.
So yes, currently I'm a resident in rheumatology right now. It's a 2-year fellowship program after you finish internal medicine. So I'm right at the end. I finish in 2 months. I did take some time off for maternity leave, so that's why I'm off cycle.
Congratulations!
So I'll finish in 2 months. And then during my residency, and actually before I even got into rheumatology residency, that's when I became involved in CATCH. So CATCH is an early arthritis cohort in Canada. So looking at patients with early rheumatoid arthritis. They have thousands of patients now. So it started in 2007, and they've been collecting data on their patients for years and years. And so I got involved as an internal medicine resident, looking particularly at fatigue in patients with rheumatoid arthritis. So that was something that was of big interest to patients, because a lot of patients have fatigue, and sometimes they'd be in remission with their rheumatoid arthritis, but they'd still have so much fatigue. So we wanted to know, what exactly happens with fatigue? Will it go away or not? And the project I did with Dr. Janet Pope looked at what happens with fatigue when a patient does go into remission. And we did see that fatigue does decrease, but it lags by about 6 months. So once the patient got into remission, there was still a decrease in fatigue afterwards, but it took about 6 months to get to the lowest point that they're going to get to. Okay. So they got their joints into remission, but there was still some leftover fatigue that took time to go away.
And in that research, did you look at early treatment of arthritis and the impact on fatigue?
So we weren't looking at like one particular treatment or another, but the whole kind of focus in CATCH is kind of looking at early rheumatoid arthritis patients, and most of those patients are getting optimal treatment early. So they're getting seen, they're getting optimal treatment early. So lots of them actually had really good scores where they had decreased disease activity by 3 or 6 months. So good early treatment, and then we saw the fatigue scores come down even lower 6 months after they got into remission.
So we're talking about CATCH. Can you explain again for our viewers what CATCH is?
Yeah, so patients who have rheumatoid arthritis can get involved and enrolled in something called CATCH. So when you get diagnosed with rheumatoid arthritis, you could get enrolled in something called CATCH, which is just collecting data on patients with rheumatoid arthritis. There's no treatment in it or anything like that. It's just collecting data on those patients. So they're seen at baseline, and then every 3 months for the first year, and then after that they get seen on a 6-monthly basis and then yearly. And it's just looking at what treatment are you on, are you in remission or not, and some other things like what's your fatigue score, what's your pain score, and then we can use that data to look at, what's happening with patients with rheumatoid arthritis, where can we improve and things like that. So
And so how do patients get involved? So is it the rheumatologist asking them when they know about catch, do you want to get in?
So when a patient gets diagnosed or likely has rheumatoid arthritis, that's when the rheumatologist will ask them, would you like to be enrolled in catch? So they get involved kind of at time of diagnosis, usually, or soon after, within the first few months.
And so is catch all over Canada?
It is all over Canada. There's specific sites that are catch sites. So depending on where you're seen by your rheumatologist, if it's a catch site, you might be asked if you'd like to be involved, but it is Canada-wide.
Okay. And I think I've heard you talk about another piece of research that is ongoing.
Yeah, so the next thing we're looking at is we're using all the catch sites who have at least 40 patients enrolled, because we wanted some bigger sites that are active in catch, and just looking at what's the same between sites, what's different, because there's so many different treatments for rheumatoid arthritis, and everyone treats patients a little differently. Are you using oral medication, sub-Q medication? Are you moving on to biologics or not? So we're just looking at what are Canadian rheumatologists doing at each site? What are the similarities? What are the differences? And does that make a difference for treatment? Are we getting all of our patients into remission quickly? Are we not? So we're just looking at each site and seeing what's the same, what's different, how are we doing in general.
Okay, so the research is ongoing.
Yes.
When do you expect to?
Probably in a couple of months.
Okay, and so after that, what's going on with conclusions, with the learnings?
So after that, I will move on. I'll be a rheumatologist in Newmarket, Ontario. So I'm joining a group there with Dr. Carter Thorne. And we hope to continue with catch. So it is a catch site. So we hope to continue enrolling patients in catch at that site. It's one of the largest catch sites for patient enrollment right now. So hopefully continue on doing some catch projects.
And so the results of those research projects, how are they used with rheumatologists? Are you raising awareness, sharing the results with the health professionals?
Yeah, so the last project I did got published in Arthritis and Rheumatology, so it was kind of shared around the world. And I've actually heard people afterwards quote to patients, because patients come in and you're like, oh, that's great, you're in remission, your joints are great, and they're like, but I'm still tired. So it's something that you could say, you know what, we know that your fatigue will still get better. So we know that you're in remission, but your fatigue is still going to improve. Yeah, so.
Okay, good. So you are almost almost done. So I want to ask you that question. So what excites you in rheumatology? Why are you doing this?
Yeah.
Is the forecast of having a cure, new technology involved in rheumatology. Earlier, or the previous days, I interviewed somebody on artificial intelligence, on early today on precision medicine. So there are new progress being made in arthritis. Is that something that is promising to you?
I think there's not one area that's exciting. Yeah. What's exciting is that when I first got exposed to rheumatology in medical school, I got to see some patients who used to be on the gold treatment and things like that. And it's just crazy how much treatment has changed over the years in rheumatoid arthritis. So from patients being on gold therapy, which is something you can't even get anymore, to us now having this slew of biologics where you can't even remember all the names of all the different biologics anymore, because there's so many biologics, biosimilars to use, that there's just always something new and something exciting on the horizon, it seems like. So I think just how much it's going to probably change over the course of my career, how many new treatments we're going to have.
One thing that is interesting, so you're involved in catch, so you understand how important it is that patients are involved in their journey, in the process of finding treatment, in their care, and how they can also play a role in self-managing their disease. So is that something that you see doing even more when you're a rheumatologist?
That's definitely something I see myself doing more of. Continuing to be involved, hopefully, and getting the patients involved, because it's so important for them to actually buy into being involved in their care, right? And it's not just about taking your medications, it's about so much more, right? Fatigue management, pain management isn't just medication. medication related. So.
Yeah. And I guess working with other healthcare professionals, that are part of the team around the patient.
There's actually a really cool team in Newmarket. There's this new program called CARE, and it has physiotherapists, occupational therapists, and also pharmacists. So it's a really interesting team. I'm really excited that I get to work there. So it's just great that there's such a big team, and there's so much patient education too. They run workshops and things like that. So it's a really, really cool thing that they have started up, and I'm really excited I get to be part of it.
So I hope it will also disseminate in other provinces. I think we had Dr. Carter Thorne actually talking about that. So I hope, it's very promising. Yeah. So before we leave, maybe we have questions.
We have one question. So do you have any tips on managing fatigue since you did the research? So this patient was hoping you have some insights into that.
Fatigue. It's interesting too because our research was based off of more so what happens to fatigue and not how to manage fatigue, and that's something that would be like interesting next steps. I think Dr. Susan Bartlett has done some research into actually managing fatigue, if I'm not wrong. So there are some interesting things on kind of how to manage fatigue and some review articles on that. But there's quite a bunch of different techniques to manage fatigue as well. Most of it patient-driven techniques too. So, whether that's graded exercise, starting out slow, even something simple as walking for a minute a day and building that up over time, to other things like mindfulness and different techniques. So there's a lot of different techniques to manage fatigue. That's not where my particular project went, but there is actually a lot of research into it.
Any other questions? No? Okay. Well, thank you so much, Melissa.
And
so good luck. Good luck for the rest. Good luck with your kid. Hard to manage everything at the same time. Yes. Okay. And thank you very much for watching another episode of #CRArthritis.